Hi friends, welcome to the channel The Nurse. Here we are discussing about second part of NIMHANS exam questions and answers. So it will be helpful for preparing upcoming NIMHANS nursing officer exams. So here also we will discuss uh, um, lower difficulty to moderate difficulty questions. I have included mainly psychiatry related questions, psychiatry and psychology related questions. So we will move to the topic. NIMHANS nursing exam model questions. This is our second part of model questions. So you can check our previous playlist. So I have included all the videos in a separate playlist. So first question is, the macronutrients that provides body with energy are carbohydrates, proteins and fats, vitamins, minerals and water, fiber, cholesterol and antioxidants, enzymes, hormones and antibodies. This question is from biochemistry. So here correct answer is carbohydrate, proteins and fats. They are mainly providing energy to our body. Carbohydrates, proteins and fats are macronutrients. Macro and micronutrients, there are different types of nutrients. So carbohydrate, proteins and fats are included under macronutrients that provides the body with energy. Carbohydrates are broken down into glucose, which is body's main source of energy is glucose. So first of all, body will use glucose from that is broken down from carbohydrates. So first source of energy is glucose. Then proteins, they are broken down into amino acids, which are used to build and repair our tissues, body tissues. If any damage occurs, the proteins are helpful for repairing the body tissues, and also it helps to build body. Then third one, fats. Fats are broken down into fatty acids, which can be used for energy or stored for later use. So if there is limited supply of glucose is there, means we can use fats for energy production. If it is unused, means we can store it for later use. So these are the main three macronutrients: carbohydrates, proteins and fats. Second question, the vitamin that is essential for blood clotting: vitamin A, C, vitamin K, vitamin D. So this is also easy question only. Correct answer is vitamin K is helpful for blood clotting. Vitamin K is essential for the production of prothrombin, a protein that is necessary for blood clotting. Without vitamin K, the blood would not be able to clot properly, and this could lead to excessive bleeding and hypovolemia, then death. Then third question, mineral that is essential for bone health: calcium, iron, zinc, magnesium. Correct answer is calcium. These are easy questions. That is why I am going a little faster. Calcium is essential for building and maintaining strong bones and teeth. It is also important for muscles function and nerve signaling. So nerve conduction also uses calcium. It is also helpful for nerve conduction, and main function is for building and maintaining strong bones and teeth. Then fourth question, the type of fiber that is insoluble in water and helps to add bulk to stool. That is option A, soluble fiber, insoluble fiber, functional fiber, resistant starch. Here correct answer is insoluble fiber that helps to make a bulk in stool. So it will reduce the chance of getting constipation. So if more bulk in stool means it will attracts more water, then it will leads to regular this bowel movement. So if there is less bulk means it will leads to less water content, then it will leads to hard stool, that may leads to constipation. Insoluble fiber is a type of dietary fiber that does not dissolve in water. It helps to add bulk to stool and promote regularity of bowel movement. Insoluble fiber can be found in foods such as whole grain, fruits and vegetables. That is why those who are prone to constipation need to take more high fiber content foods such as whole grains, fruits, and vegetables. Fifth question, the type of fat that is considered to be healthy fat, that is saturated fat, trans fat, unsaturated fat, hydrogenated fat. The options are very confusing, so you need to be careful while answering. Correct answer is unsaturated fat is known as healthy fat. Unsaturated fat is a type of fat that is considered to be healthy fat because it can help to lower cholesterol levels and reduce the risk of heart disease. That is why it is known as healthy fat. Unsaturated fat helps to reduce the cholesterol level and that leads to the risk of reduce the risk of heart disease. Unsaturated fat can be found in foods such as olive oil, avocado oil, and nuts. Then sixth question, the most important fluid in the initial management of a burn patient is normal saline, ringer lactate, colloids, dextrose. So here is an example, normal saline, ringer lactate, dextrose. Correct answer is here ringer lactate. The first initial management of burn is used with ringer lactate. Ringer lactate solution is balanced crystalloid solution that is used to replace fluids and electrolytes lost in burn patients. So main problem that is in burn patient, that is hypovolemia. So hypovolemia with hyponatremia and electrolyte imbalance will be there. And second important problem is infection. So to manage hypovolemia in initial stage, we can use ringer lactate. Ringer lactate is the preferred fluid for initial resuscitation of burn patients because it is closest to the composition of human plasma. So that is why we can use easily ringer lactate to replace electrolytes and fluids. The composition that is similar to our human plasma, so it can be easily replaced. Then seventh question, the best way to assess the burn size in a child is to use which method? Best way to assess the burn size in a child is use of which method? Length and Browder chart, Parkland formula, rule of 9, Wallace rule of 5. So in child, we can use a Length and Browder chart for assessing the burn size or percentage of burn area. So Parkland formula is used for replacing the fluid. Rule of 9 also we can use, that is usually it is effective in the case of adult, that is body part is divided into 9 equal parts except perineal area given 1%. Wallace rule of 5 also it is used to assess the bone area, that is also useful in the case of adult. So we can place the palm and we can assess the area with how much the area is affected, the burn is affected by the use of palm. So that is Wallace rule of 5, or we can use palm method also. So in Length and Browder chart is a more accurate way to assess the burn size in children because it takes into account the child's age and body surface area. So in other cases, rule of 9 and Wallace rule and all, it is only concentrating the body area, but in the Length and Browder chart, it is considered about that person's age also, child's age also. So I will show you the calculation method. So here is the Length and Browder chart, child assessment chart. So here three area is divided into separately. That is head it is given A, and upper thigh is given B, and lower leg is given C. So other area it is specific to all age group child is same percentage area only, but only in the case of A, B, C, that is head, upper thigh, lower leg. These are different for different age group. So in the case of A area, that is half of the head, or we can see anterior part of the head. So for age group 0 to 1, it will be anterior side will be 9.5%, and B area, that is thigh area, that will be half of thigh. It will give 2 3/4, and C area, that is lower leg, that will give 2 half for age group of 0 to 1. Then age group of 1, the head area that will reduce, because in child head area will be more and body area will be less. So while increasing the age, the anterior part of the head, that is 8.5, then up thigh, half of the thigh, or we can say anterior part, or it is 3 by 3, 1/4, and third lower leg it will be 2.5, same only. At the same time, age group of 5, it can be head part can be considered 6.5 only, anterior part, posterior part also 6.5 will come, and B, that is upper thigh, will be 4. So here increasing, thigh area is increasing and head area a percentage is reducing, and lower leg it is slightly increased to 3/4, and age group of 10, head area will be 5/2, upper thigh, that is 4 1/4, and lower leg, that is 3, anterior part 3, posterior part 3. So like that, age group of 15, 4.5 head, 4.5 thigh, and 3 1/4 for lower leg. So that is a different in as per age group. So it will be easy and accurate for calculating burn area in children. So this is Rand and Browder chart that is used for calculating burn area in children. Then eighth question, the main goal of fluid management in burn patient is to prevent hypovolemic shock, promote wound healing, prevent infection, all of these. So correct answer here, all of these. The main goal of fluid management in burn patient, that is includes prevent hypovolemic shock, that is one of the important and fatal complication, and it will helps to promote wound healing because it will helps to increase the circulation, and it also helps to prevent infection. By increasing the circulation, the antibody or immunoglobulins will reach the burn area, and it helps to prevent infection. The main goal of fluid management in burn patient is to prevent hypovolemic shock, promote wound healing, and prevent infection. The ninth question, the following are signs and symptoms of hypovolemic shock in burn patients except option A, tachycardia, option B, hypotension, option C, oliguria, option D, cyanosis. So correct answer here, cyanosis. Except cyanosis, all other options are symptoms of hypovolemic shock. Cyanosis, it is seen in hypoxemia. Cyanosis is sign of hypoxemia, not sign of hypovolemia. Then 10th question, a 3-year-old child presents to emergency department with a burn to his chest and abdomen. The burn is red and blistered, and the child is in pain. The burn is most likely to be a. So you need to go through the symptoms, then only you can give correct answer here. So option 1, first degree burn, option 2, second degree burn, option 3, third degree burn, option D, fourth degree burn. So symptoms include the burn area is red and blistered, and the child is in pain. The pain also, it is very, very important sign only in the case of burn. Here correct answer is second degree burn. In first degree burn, there will be redness and pain will be there. Only redness, blister will not be there in first degree burn. That is superficial, and that is epidermis is involved. In the case of second degree burn, there will be involvement of dermis, epidermis, and below that dermis is there. Dermis also involved. It will cause a blister and pain. Severe pain will be there due to the nerve damage. And third degree burn, the below the epidermis, there is a subcutaneous fats and subcutaneous tissue. The if it is involved, that epidermis, dermis, subcutaneous tissue, if it is there, means it is known as third degree burn. Then if it is reached till the bone, and it is known as fourth degree burn. So according to the depth, burn is classified into four degrees: first degree, second degree, third degree, fourth degree. Sometimes third and fourth degree will be combined, and third degree that will include subcutaneous tissue till the bone. But in some other classification, there will be separate third degree and separate fourth degree will be there. Second degree, that answer of the question. Second degree burns are characterized by redness, blistering, and pain. The burn depth extends into dermis, that is second layer of skin. In the case of first degree, characterized by redness and pain, but the burn depth does not extend beyond the epidermis, that is a superficial layer, outermost layer of the skin. Then third degree burns are characterized by white leathery appearance. The skin will be loose and it will be easily removable. So that is what leathery appearance. The burn depth extends into subcutaneous tissue, the layer of the tissue below the that is dermis. So subcutaneous tissue will be below the dermis. So in the case of third degree, the pain will be less because of massive damage to the nerve. So first and second degree case, nerve endings only damaged, so pain will be more. So, but in the third degree and fourth degree, entire nerve supply will be damaged, so pain will be less. Fourth degree burns are characterized by carrying of the skin and underlying tissues. The burn depth extends into the muscles and bone. So that is fourth degree. Then 11th question, which of the following is a common feature of all personality disorder? They are present from birth and do not change over time. They cause significant distress and impairment in functioning. They are associated with a specific genetic or biological factor. They are rare and affect less than 1% of population. So the common feature of the personality disorder, all personality disorder includes they cause significant distress and impairment in body and mental functioning. Personality disorders are defined as enduring patterns of inner experience and behavior that deviate markedly from the expectation of the individual cultures and cause significant distress or impairment in social, occupational, or other areas of functioning and are stable and of long duration. So their impairment will be social, occupational, or other areas of functioning. That may be body functioning. Everything may include in personality disorders. There are 10 types of personality disorders with each with different characteristics and symptoms. And these 10 personality disorders are organized into 3 clusters based on common features and symptoms. So that cluster include, first is cluster A personality disorder, that involves unusual and eccentric thinking or behaviors. They include paranoid, schizoid, and schizotypal personality disorder. Paranoid means there will be excessive doubt to other person. They may come and harm them, or they may abuse them, like that paranoid thinking. Schizoid means there will be a decreased personal relationship with others. Schizotypal means there will be a magical thing, delusions, illusions, and all will be present in schizotypal personality. That is different from schizoid. Schizoid mainly, the people will be used to sit alone and not interested to mingle with others. That is the schizoid personality. Schizotypal means that is magical thinking will be there. A delusion, hallucination, and all will be there in schizotypal personality disorder. Then cluster B personality disorder, that may include dramatic and erratic behaviors. They may include antisocial, borderline, histrionic, and narcissistic personality disorder. Antisocial means they will not consider the rights and the rules and regulations in the society. They will be destroying like a character. Borderline personality disorder means that is that personality will be usually unstable. The mood swings usually common in borderline personality disorders. Histrionic also same like behaviors will be there. Narcissistic, histrionic in the sense they will be more attention seeking. They will do something and used to get attention from others. And same like similar like narcissistic personality also, they are also will do something and to get attention, or they will used to get dependence from others, like a personality that includes cluster B, narcissistic type of personality. Then important type is cluster C personality disorders. They are mostly anxious and fearful, and also always dependent with others. That is, one is avoidant. Because of the anxiety and fearfulness, they will avoid the company with other friends and all. They will like to sit alone because of decreased confidence and inferiority complex and all will be there in avoidant personality. Dependent personality disorder, they will show they will dependent each and everything with financial and all other thing, they will dependent with others. Same time, obsessive compulsive personality means they are very much strict about their character. They will be like perfectionist, that kind of personality disorders in it. Obsessive compulsive personality disorders, these are the main types of personality disorders, and each and every one I will ask in coming questions. Which personality disorder is characterized by a pervasive pattern of disregard for and violation of the rights of others? So I have explained it there. So you can answer if it is you understand means you can answer here. So correct options are antisocial personality disorder, borderline personality disorder, narcissistic personality disorder, paranoid personality disorder. So one clue is it is from cluster A type of personality disorder. So here two symptom options are from cluster A, that is antisocial and paranoid personality. Out of that, one is correct answer. That is antisocial personality disorder. So we will discuss antisocial personality disorder here. It is characterized by a pervasive pattern of disregard for and violation of the rights of others. They will not concern the rights of others, and they will not consider others privacy and all. The main pattern of their thinking is violent behavior, and they will use to lie, and they will use to do stealing things, and they will use to cheat others. Aggression will be there, and violent behavior will be there. These are the characteristics feature of antisocial personality disorder, and it is an example of cluster A personality disorder. 13th question, which personality disorder is characterized by a pervasive pattern of instability in interpersonal relationship, self-image, and affect and market impulsivity? And options are antisocial personality disorder, borderline personality disorder, histrionic personality disorder, schizotypal personality disorder. So in this answer, it belongs to cluster B personality disorder. Here, there are three types of cluster B personality disorder, except antisocial personality disorder. All other belong to cluster B personality disorder. Correct answer is borderline personality disorder is characterized by pervasive pattern of instability in interpersonal relationship and self-image and affect and market impulsivity. So we'll discuss in detail. Borderline personality disorder is characterized by a pervasive pattern of instability in interpersonal relationship. They will not use to maintain the interpersonal relationship with relative friends and their co-workers. And self-image and affect and market impulsivity will be there, such as frequent mood swings will be there for a as a characteristic feature. Suicidal threats will be there, or gestures. They will do some to suicidal threats, and they will do like strangling like gestures, and they were used to do self harm, or they were used to cut their hands, or they used to do substance abuse. These are the characteristic feature of borderline personality disorder. Main thing will be the unstable interpersonal relationship and mood swings. These are the main characteristic feature of borderline personality disorder. 14th question. Which personality disorder is characterized by pervasive pattern of social and emotional detachment and a restricted range of expression of emotions in interpersonal settings? It is also example of cluster B personality disorder. Options are avoidant personality disorder, dependent personality disorder, obsessive compulsive personality disorder, schizoid personality disorder. If you understand that clusters, you can answer here correctly, because um, all three are examples of cluster C personality disorder. Only cluster B personality disorder, that is schizoid personality disorder. They used to maintain the interpersonal relationship, and they used to sit alone. Poor social contact will be there, and that is the main characteristic feature of schizoid personality disorder. They would used to sit alone. Same time, schizotype means, I already told, magical thinking will be the main characteristic feature of schizotype personality disorder. So here correct answer is schizoid personality disorder. Schizoid personality disorder is characterized by a pervasive pattern of social and emotional detachment and a restricted range of expression of emotions in interpersonal settings, such as indifference to praise or criticism, lack of close friends or confidence, or preference for solitary activities. They used to do activities alone only, and there will be a lack of emotional expressions, and they used to avoid the friends interpersonal relationship. These are the characteristic feature of schizoid personality. Then 15th question. Which personality disorder is characterized by pervasive pattern of excessive emotionality and attention seeking? Another type of cluster B personality disorder: histrionic personality disorder, narcissistic personality disorder, paranoid personality disorder, schizotypal personality disorder. So attention seeking and emotionally and excessive emotionality and attention seeking personality disorder, that is histrionic personality disorder. Histrionic personality disorder people will show excessive emotionality and attention seeking. Histrionic personality disorder is characterized by a pervasive pattern of excessive emotionality and attention seeking, such as being uncomfortable when not the center of attention, using physical appearance to draw attention, being overly dramatic or theatrical, or being easily influenced by others. So in current scenario, that Instagram reels people and all, they are used to do this attention seeking technique. So they will do something, and they used to get attention from their followers. So these are the questions for part 2 on NIMHANS Nursing Officer exam model questions. So I will come with another part soon. So please stay tuned in. And if you have any doubt, means you can ask in comment section, so I can explain there. So please stay tuned, and we will come with another video soon. Thank you. Thank you for watching this video. Please like and share this video with your friends.